Welcome to the Living Well podcast by Jefferson Health. I'm Carly Williams.
And I'm Jessica Lopez. It's a completely normal response to feel alarmed or worried if you see blood in the toilet or when wiping after a bowel movement. Today we're talking to gastroenterologist Dr. Lucy Jew about understanding what it might mean.
Dr. Jew breaks down possible causes of bleeding, from hemorrhoids and anal fissures to inflammatory bowel disease or even cancer.
She shares how everyday habits can affect our gut health, including those extended scrolling sessions with your phone in the bathroom.
Dr. Jew also offers her expert tips for improving your gut health and supporting better bowel movements. Here's our conversation with Dr. Jew.
My name is Dr. Lucy Jew. I'm one of gastroenterologists at Jefferson, New Jersey. I practice out of Cherry Hill, New Jersey.
Thank you so much for joining us. What are the common causes of blood in your stool?
I think when you have bloody stools, you have to really approach it. Is it coming from your upper GI tract or from lower, such as your colon? If you're seeing bloody stools that are black, tarry-like in color, tend to think that's coming from your stomach or your upper small intestine. And things that could be causing that are ulcers, inflammation, or any type of upper GI pathology. Then you address the bloody stools, which are bright red in color, and then that can range from just a small, scant little blood on your toilet paper that you see as you wipe, to progressing to passing frank blood clots, to even bloody stools where the blood is actually mixed in with your stools. So depending on the type of bleeding you're seeing from down below, you can then say, okay, is this an anal fissure or a hemorrhoid that's bleeding? And interestingly enough, a badly bleeding hemorrhoid can actually have passage of bright red blood and blood clots. When you start seeing blood that's mixed in with your stool or like a bloody diarrhea, then you start to think of, is this an inflammatory bowel disease? So things like ulcerative colitis or Crohn's disease. And then obviously what we always want to make sure, is this an underlying colon cancer that has not been diagnosed yet?
Can you develop hemorrhoids at any point in your life? And what exactly are anal fissures?
They can happen at any point in life. If you have constipation or a sedentary lifestyle, the pressure can contribute to hemorrhoids. And if they're internal, you won't necessarily know that you have them until you start developing symptoms. Internal hemorrhoids can sometimes prolapse out and you start feeling them without you necessarily knowing, like, hey, they're there. Fissures have a broad spectrum. They can be acute and chronic. They're almost like little small tears within the anal canal, and they obviously can bleed. It's like a little cut almost, for lack of better words.
If you wipe and see blood in your stool one time, should you be concerned? Is it when you're starting to see it on a more regular basis?
Anytime you see blood, it should be discussed. And it doesn't always have to be escalated to a colonoscopy, but I think you should at the bare minimum discuss it with your primary care provider. If you see scant blood once and it resolves, it probably is something very simple, like a little fissure or a small hemorrhoid. Once you start seeing it more frequently and increased volume, then I would definitely bring it up to a provider.
And what are some of the diagnostic tests that are typically performed if you do see a physician?
There's a whole spectrum. Generally, we do tend to start off with something simple as an in-office rectal exam, where we can take a look at the anal canal and do a digital rectal exam for any palpable lesions, and most certainly for any kind of hemorrhoids. I do always check blood work just to make sure you're not anemic or make sure your blood count has not dropped. And then we can also do more subtle tests. And again, it depends on age, risk factors, and symptoms. Do some stool-based tests to see, is there microscopic bleeding that maybe we're not seeing on exam in the office, but you've had this bleeding witnessed at home and we're just not catching it today.
Are there any certain foods or anything that can mimic the appearance of blood in your stool?
Oftentimes, one of the over-the-counter medications, specifically Pepto-Bismol, can discolor your stool to be very dark in color, can sometimes make it look like it's blood, but it's not. Iron and leafy greens can make your stool darker. Then a lot of the food-colored stuff, like I've had a patient come in that ate a lot of beets one time and then started having red stools, and it wasn't blood because I tested for it, but it was just coloration from beets. And along those lines, red velvet cupcakes, a dye in there can definitely color your stool to make it look red. Food colorings can change your stool color without it being blood. But again, it's something that you can discuss and talk to your primary care provider and go from there.
How can we differentiate between benign causes and more serious conditions like colorectal cancer, like you mentioned before?
We do colon cancer screening starting at the age of 45. Age definitely plays a role into it. Things that we look for are what we call alarming symptoms. So, isolated rectal bleeding alone that needs to be investigated, but what alarms us as a gastroenterologist are things like weight loss, documented anemia or low blood count, and changes to your bowel habits. If you were someone that was having a daily bowel movement and all of a sudden you're having bloody diarrhea 4 to 5 times a day, some kind of change like that makes us think, okay, there's something else going on.
And how often should people get screened for colon cancer? And are there any other early warning signs that people should be aware of?
That's a very great question. Everyone should of average risk. So that's a patient that doesn't have any family history of colon cancer or any personal history of things like ulcerative colitis or Crohn's should start colon cancer screening at the age of 45. Those that are higher risk or have a family history start their colon cancer screening at the age of 40 or 10 years earlier than their family members at their time of diagnosis.
Can we talk about what else our stool could be communicating about our health, like from color to size and shape to times a day?
I ask patients this all the time in the office. I use something called the Bristol stool chart. It gives a picture and verbal description of one's stools, whether it's hard lumps and pellet-like, which is going to be type 1, then extending to the spectrum of liquid consistency without solid pieces. This stool chart breaks down type 1 to 7, and it gives you an idea of saying, hey, are you constipated because you're lacking fiber? Are your stools formed and normal in size and caliber? Or are we then at the other end of the spectrum and you're having looser stools and there's signs of inflammatory changes or some infectious process?
I read it somewhere earlier this week that your GI tract is doing the right thing if you go to the bathroom the first thing in the morning when you wake up.
I don't think that's necessarily true. Everyone's patterns are a little bit different. Having a bowel movement is different for everyone. Some people have a bowel movement daily and that's their norm. Some people go every 1 to 2 days, but it's a good formed solid stool without any difficulty straining. That's their norm. So I don't know that the timing of bowel movement really correlates to overall health and well-being.
Good to know. That is a myth. Can we talk a little bit about lifestyle changes someone could make to help promote gut health and have healthier bowel movement?
Yes, I'm a big proponent of fiber and hydration. A healthy lifestyle is what you need for overall gut health. You want about 25 to 30 grams of fiber daily, whether it's via your diet or adding a over-the-counter fiber supplement. You want to make sure you're adequately hydrated, healthy foods with fresh fruits and vegetables. And a probiotic is also very good for overall gut health.
Does stress play a big part in gut health?
Oh my goodness, stress is a huge effector of your digestive system. It can affect anywhere from your stomach to your small bowel to your colon. Everyone manifests a little bit differently. Some people can get nausea with stress. You can get diarrhea or constipation with stress. So I think stress is one of the unseen factors of your GI system and overall well-being in terms of lifestyle, stress control, sleep, and diet as well.
And you talked a little bit about how you like to get natural probiotics through your food for your gut health, but we were wondering if there's anything else that you do to support your own gut health as a gastroenterologist.
I'm a huge proponent of fiber, whether it's through supplement or diet. And there's days or times when you're traveling where, you may not be getting the appropriate fiber intake with your meals. And I think that's a great time to add that supplement.
Can I ask what are some of those natural sources of fiber that you're turning to?
Yeah, fruits and vegetables, whole grain foods, they make fiber fortified almost anything at this point. You can get a lot of insoluble fibers just through cereal as well.
What's one way that we could be sabotaging our own gut health without even realizing it?
I think dehydration might be one of them. A lot of times you're not drinking enough fluid or you're counteracting whether it's caffeine or alcohol, which are a little bit dehydrating. And I think that can really affect your stool caliber and consistency, which also affects gut health.
The only other question that I wonder about is our habits now of bringing our phones into the bathroom and spending a lot more time on the toilet if you get lost and start scrolling, how it's really not good for you.
That's one of the questions I ask my patients all the time, especially after the fact where we do the colonoscopy and everything looks good. There's no cancers, there's no inflammatory bowel disease. And they ask, how did this happen? I exercise, I'm not constipated. Then you ask them, what are your toileting habits? Do you go in and do you have your bowel movement and then you wipe and you're off? Or do you linger? Do you stay on the toilet because you're on your phone? You've now cycled into some vicious TikTok cycle and you don't realize that 5 minutes quickly turned into 25, 30 minutes. I do think that definitely contributes to hemorrhoid formation. And again, I also tell patients, if you don't feel the urge to have a bowel movement, you don't need to sit there for 30 minutes to try. Wait until that urge comes.
Do you recommend toilet stools to your patients?
I actually do. I think it's good at correcting the angles of defecation for most. When it sounds like hemorrhoidal and after the workup and exam it is hemorrhoidal, we want to make lifestyle changes. We want to increase fiber, make sure we're getting the 25 to 30 grams daily. We want to make sure we're not straining, we're not spending too much time on the toilet. And certainly implementing a squatty potty is very simple and something that's very benign to do.
I feel like a conversation like this really emphasizes that you can and should be talking to your doctor about anything that's coming up with your health. Do you have any advice for people who may feel embarrassed or hesitant to bring something up like bloody stool to their doctor?
I don't think you should ever be embarrassed about bringing anything up. This is what we do day in and day out. This doesn't faze us. We want to know about it because it tells us things that may be going on inside that might not necessarily be manifesting outside just yet. This is our job. This is what we do. Don't be embarrassed. If there's ever a question where you're like, hey, maybe that was blood or I'm not entirely sure, snap a picture of it and then you can bring it in with you for your office visit.
Be sure to check out the show notes for additional resources, including the link to the Living Well blog where we publish full episode transcripts.
And as always, if you enjoy our podcast, we truly appreciate a rating on Apple, Spotify, or wherever you listen to podcasts. The full podcast episodes are also available on our YouTube channel at Jefferson Health.
Production support for today's episode provided by Brittany Rafalak. We're your hosts, Jess Lopez
and Carly Williams. Be well.